Hello, everyone. This is a very, very cool thing. I'm very excited to be here. My name is Aidan Shuck, and I'm here with Dr. Brett Butterfield. He owns Nampa Naturopathic Health Clinic, this awesome facility that we're in. And today, we've got questions about TBM. And I'm just going to kind of leave it to you to explain, who, what, when, where, why.
Sure.
TBM, what you do, and we'll just go from there.
Of course. Yeah. So I've been a practitioner of TBM for over 10 years now, and it's a system of applied kinesiology,
Okay.
which has been in practice in the United States and throughout the world, really since I think the late 50s, and so TBM is an acronym for total body modification,
Okay.
and that's really just referring to the holistic nature of the technique.
That makes sense.
Okay, so it's treating the whole body, and the system was put together by Dr. Victor Frank, who was both a chiropractor and a naturopath.
Wow.
And he really had a lot of knowledge and a lot of different trainings, and he put a lot of the different techniques together into this one system. So in one way, it's chiropractic, but it's very naturopathic, and I'm a naturopathic doctor,
Okay.
and so it's very well suited to my training, and it's just a great technique for treating someone holistically and helping them to reach their health goals, in a way that's systematic and to a large extent reproducible.
Gotcha.
Mm-hmm.
Awesome. So, applied kinesiology, does it differ from, is TBM only applied kinesiology, or does it move away from that in some places? Does it share more than what it differs in? Kind of explain the difference between, are they basically synonymous? How do they, those two terms, TBM as a method versus applied kinesiology as a field?
Sure. Okay. So applied kinesiology is different from the study of kinesiology. So applied kinesiology, there's an International College of Applied Kinesiology that has been responsible for the training and education of all these health practitioners. And so it's a system. One of the lay terms we use for that is muscle testing.
Okay.
So if someone is watching a practitioner do applied kinesiology and another practitioner do TBM, they probably look kind of similar, but there's a lot to distinguish them.
Okay.
Victor Frank said applied kinesiology is too much like work, and now that's to some extent for the practitioner, but it's also for the patient. So it's very results based, and I think you're able to get see progress and results in a very short period of time. And it does use a different sort of technology, a way of tapping into the body and getting the body to get in that state of healing, in that parasympathetic state, okay, of rest, digest, and heal.
Yeah.
Which is one of the biggest issues, is everyone's stuck in fight, flight, and stress.
Yeah.
Mm-hmm.
Yeah. That's a constant thing in this world.
Yep.
Unfortunately.
Mm-hmm.
What does a appointment look like generally? Like, if someone comes in and it's not their first time, you've kind of got them in a regimen or on a program, what does that look like, and what results are tied to that? Say someone's right in the middle of a program with you.
Mm-hmm.
What can they expect, and what are the results that they're most likely to get?
Sure. Okay, so someone comes in, and the visits are typically shorter visits, 20, maybe 25 minutes,
Okay.
and they're very hands-on, where I'm doing testing with the body, and based on my assessment and the testing, I do specific corrections, adjustments. Really is what I'm attempting to do, is attune the nervous system because the nervous system is the master system in the body. That's where the chiropractic sort of theory comes in, but it's true.
Yeah.
And I think that's well known throughout the health sciences, is the nervous system controls every cell in the body, controls all of our functions, and keeps us healthy and functioning as we should. So that's really where the TBM is focused at. And in that way, we're getting to the root cause of what's going on, because if the problem's in the nervous system, that's where it needs to be addressed. And we support the other systems in other ways as well. So we use some, we're very big on diet and lifestyle protocols.
Yeah.
And then we'll use some supplements. And that is how we use them. They supplement diet and lifestyle and then these TBM procedures, but they all work very synergistically together.
Yeah. I love that, because supplements, a lot of people take supplements like pills, and I say pills like a medication, where it's just take this, call me in the morning, and you're expecting a specific result, but to know that it's supplementing your lifestyle. It can't make up for a deficiency in lifestyle and in diet and all these other good things. It's supplements. And that it can change with how your lifestyle is improving or falling. Depends on where people are at in their health journey. Who can benefit from TBM in general, kind of as a general thing, and who would benefit the most?
So TBM is very versatile. So it can really benefit a lot of different conditions and a lot of different symptoms. And in practice, so my practice has largely been general practice, a family practice. So I've really done cradle to grave and all kinds of conditions.
Okay.
I'm certainly not, there's things I refer out to. Sometimes we need a specialist on board, and I'm not treating cancer or anything like that. I think it can be great complementary care in some of those really severe conditions. But I want to work hand in hand with another professional. But really, one of our major focuses in our clinic is it's been very successful with helping with food allergies and sensitivities, and really you could say seasonal allergies, any kind of allergies, helping out with the reactivity of the body. So we've seen it be very helpful with multiple chemical sensitivity and things like that. So that's really where we focus quite a bit. And then also my wife works with us here in the clinic, and she has a history of food sensitivities, and so she's really good at helping coach on the lifestyle portion of it too, which is a huge part of overcoming that.
When we went, when my wife and I were going through, the first portion of your program, when you and I first started working together, I remember your wife being awesome with having resources for recipes. Like she's put in a lot of work to understand the food aspect of this diet and lifestyle change, specific for allergies. It's awesome that you're kind of able to focus and see those results in that, because so many people experience. My family years and years and years ago had some of the worst food allergies I've ever seen, and we did a lot to fix that, but it's interesting to think just how much faster we could have gotten past those with you around and with these techniques. It's interesting for me to think about that, having lived through it without these kind of hot knives and butter techniques versus what my wife and I experienced. My wife has a lot of health issues, and so it's cool to see kind of both sides of that. And it's impressive how your wife is very good with those resources, and she's put in the work.
She's great, and people really love working with her. She's a very sweet woman. But yeah, shopping, cooking, dealing with kids and family. She's very good at all that. It's a huge part of people achieving their goals, and I'm grateful to have her with me.
That's awesome. So, where can people find you to get this kind of treatment? Like, obviously Nampa Naturopathic Health Clinic is your business, your clinic. Do you have YouTube channels? Do you have Facebook pages? Like, what's the easiest way to get in touch with you and with this method?
You're saying to learn more about it, or to contact us?
To contact you specifically, but then also, I think just to learn more, because this is a very
It's very novel.
It's very novel.
It's new to a lot of people.
It's not new, because it's been around for a few years.
It's been taught since 1978.
Okay.
Around the world.
Novel is a good way to put it.
Yeah.
It's not like it's chronologically new, but it is a.
Yeah. Yep. It's just unfamiliar. And, so. There are I think there's a lot of great information on YouTube, both from TBM and then also from me on my channel. I've done
awesome.
I've made dozens of videos to help people learn, and a lot of on diet and lifestyle that's going to support someone while they're going through this process, and then also to learn more about the process itself.
That's awesome.
So I think we're strong on YouTube. We do weekly posts on Facebook on our Nampa. So it's both for YouTube and Facebook. Nampa Naturopathic Health Clinic.
Okay.
We have a website which is NN Health Clinic, like Nampa Naturopathic. NN healthclinic.com.
We'll make sure that all these links are easily available for everyone. We'll make sure that you can get to it easy.
Yeah, thank you, Aidan. And so you're able to contact us through the websites, or we work with a lot of people over the phone, and I think we've made it very accessible.
Good, that's good, because this is a very, from my personal experience, this is a very strong, wonderful method, and a very capable practitioner. Several practitioners, because your wife is working alongside you, which I think is just that much better. Anything that you would specifically emphasize or like to add that wasn't something that there was a specific question for, about what you do and about the experiences that people have with you as a practitioner, and just kind of open to you, anything specific you would like to share?
Yeah, I guess just that I was a naturopath first and foremost. I'm a licensed naturopathic medical doctor here in the state of Idaho. So I have prescription rights, and I think people come to me because they want to get off their prescription medications,
right,
and I can help them do that.
Awesome.
In many cases, not in all cases, but and going through naturopathic school, you get a lot of exposure. It's a very eclectic profession, and so there's a lot of different options and healing modalities. And so as you go through that experience of school, you kind of start gravitating to one thing or another. But I have just always really been impressed with the benefits. I was exposed first to applied kinesiology, and I was impressed with that. But I've really been very impressed with the results of TBM, because I'll often say to patients, you're not the same person who got on my table when you get off. Because when we're affecting a change in the nervous system, it's like we're flipping on light switches, or I'll say the fuse in the fuse box a lot of times.
Yeah.
So your body is already functioning better when you get off the table. And so I expect to see results quickly, and that's how I've felt them, and I've experienced them personally.
Same.
And so I think we can help people make progress in many cases very quickly.
That's awesome.
Mhm.
I will just second that it works very well and in a pretty darn timely fashion.
Mm-hmm.
It's, there's no ridiculous claims to be made, but it works and it works well.
Mm-hmm.
And I remember you had helped, I think both my wife and I, at one point when we were just not feeling well, like sick with a bug or something. And my wife went from, basically sick in bed to up and around the house, just busybody. She's just couldn't keep still, had all these projects she wanted to do in a totally different state of mind and body than she was not even 4 hours before. And, no fantastic claims to be made, but it works. And it works well, and it works quickly.
Well, and it does require work. We say if you change nothing, nothing will change. And so it's usually required to make some diet and lifestyle modifications. Unless, we have people who come to us and they're already doing really pretty well with their diet and lifestyle. We just do a little tweaking, but they're not getting the results they deserve because there's a problem in their body that does need assistance. It needs these neurologic attunements to get the body back on track so it can do its job, and then their body can really use that proper diet and lifestyle.
It reminds me of this imagery of like a dam, and how they let a certain amount of water out at a certain point, but that's not the full potential of what's behind the dam, and you can be doing and adding all of these good things,
right?
But you'll only see the results of what the actual body, the structure, the dam metaphorically, will let through. And so that strong, very specific work in the body and in the nervous system opens those floodgates. People can be doing every good thing, still not be getting the results they want. Bam, and it'll work so much better with those couple of tweaks to lifestyle, but then with those specific procedures that you do and that you're very good at.
Thank you.
That's kind of was my story. My wife has got a lot of health issues, and so we're working through many other things, but it was a big jump forward after working with you, and
thank you.
It's just been a very cool thing to see. So, Dr. Brett Butterfield, Nampa Naturopathic Health Clinic, TBM practitioner, applied kinesiology expert, licensed naturopathic medical doctor, able to work with prescriptions and all these other good things. It's a big difference to be made because there's a lot of naturopathic practitioners who aren't state licensed. That's a big thing in my mind, that you've got a lot of ability, authority. I'm trying to think of other ways to explain it, but you're a doctor, not. And I hate to say this because there's a lot of really good naturopathic practitioner professionals out there.
Yeah.
But there's a difference. You're an ND.
Yeah, I have a lot of respect for those guys, but it does open doors to have a license. I've oftentimes heard them say that we don't need licenses, but I've noticed they hire licensed people to work for them so that they can do the things that
makes sense.
that the patient needs or the patient wants, and so we have the ability to do a lot of things here in our clinic because we've jumped through the hoops, and so grateful to have that education and
put in the work, and now your patients get to see the benefits for that. So
that's what it's about. Absolutely.
All right. Any last words as we kind of wrap this up?
I think that's great. Yeah, thanks so much, Aidan.
Awesome.
I appreciate it.